Good evening and welcome to Over the Counter, a half-hour show that focuses on health. My name is Monique Hammond, I'm a pharmacist, and tonight our topic will be one more time Alzheimer's disease. And my special guest tonight is one more time Dr. William Fry, who is a PhD and a neuroscientist of international acclaim. And Dr. Fry has been on such shows as Good Morning America and Inside Edition and so many more, but tonight we are very fortunate to have him talk to us about Alzheimer's disease. Dr. Fry is also the Director for Research at the Alzheimer's Research and Treatment Center at the St. Paul Ramsey Medical Center. So please welcome back Dr. William Fry. Well, good evening, Dr. Fry, and welcome one more time to Over the Counter.
Thanks, Monique.
And thanks for coming. Dr. Fry, last time when we were visiting, we were talking a little bit about Alzheimer's disease and how it is genetically, kind of maybe caused and what other causes were and all that kind of stuff. Could you, to get us up to speed tonight, could you give us one more time a quick definition of what Alzheimer's is from the point of view of the neuroscientist?
Okay, Alzheimer's disease is a particular type of dementing illness. Dementing illness is characterized by memory loss, confusion, disorientation, personality change, that type of thing. One particular disease that can cause those symptoms is Alzheimer's disease, and it's differentiated from the other dementing illnesses because of the particular type of brain changes that occur with the plaques and tangles that we discussed last time.
Okay, Dr. Fry, there is one thing that we're always wondering about. Can we protect ourselves from Alzheimer's disease, from getting it? Can it be prevented?
Well, no one knows the answer to that yet. There is a lot of research being done in our research center at Ramsey and at other centers around the country to try to develop methods of preventing Alzheimer's disease or to protect ourselves from Alzheimer's. Some studies that have been done recently have noted that people who have arthritis tend not to get Alzheimer's disease as much as individuals who don't have arthritis. And researchers who have been looking into that feel that that may be due to the fact that those individuals are consuming a large amount of anti-inflammatory drugs for their arthritis. And perhaps these anti-inflammatory drugs have some protective effect against Alzheimer's disease. This does make some sense teleologically, since we know that there is an inflammatory reaction in the brain in Alzheimer's disease. And so it does sort of make sense that maybe some of the drugs used for treating arthritis might in fact help prevent Alzheimer's. Having said that, the data, although it's very interesting, is a long way from being conclusive, and we really don't know if it will protect people from getting Alzheimer's at this point. So I'm not encouraging people to go out and take ibuprofen or something else. I don't think we really know enough about it yet, but I think this is a promising area of research in terms of prevention. The other area of research I think that is most promising in terms of prevention is the nerve growth factors. These are naturally occurring substances. They're proteins that are normally found in the brains of humans and other animals that have been found to protect brain cells from brain damage, from damage to the nerve cell, and also to prevent degeneration of nerve cells. So it's possible that if we learn a little bit more about these nerve growth factors and find a way of carefully administering these to individuals who are at risk for the disease, that we may be able to protect those individuals from Alzheimer's. I think that's our hope, at least in terms of preventing the disease at this point.
Now, those nerve growth factors, where do they come from? Do they make those in a laboratory?
Well, nerve growth factors are normally made by the cells in your brain. However, there are two or three companies, Genentech and Syntex are two companies in California, and then Regeneron, which is on the East Coast. Each of these companies has taken the human genes for different nerve growth factors and has cloned these genes in bacteria, or made the bacteria produce these natural human proteins. The bacteria thinks it's supposed to be doing it, and it's producing these, and then the company isolates these natural human proteins that the bacteria makes using our genes. So these materials are available. The question has been so far, how can we administer these? We know that they protect brain cells from damage. We know that certain of these nerve growth factors are very promising because they will increase the amount of the chemical messenger used for memory, called acetylcholine. So those are very promising for Alzheimer's disease. The difficulty has been that if you take them as a pill or a shot and they get into the blood, they are not able to cross from the blood into the brain because of a protective barrier called the blood-brain barrier. Our research at the St. Paul Ramsey Medical Center has indicated, however, that if these drugs are administered as nose drops, that they may be able to enter the brain along the nerves involved in smell. There is no barrier there, and substances can go directly into the brain along those nerves. We will be actually presenting some of our latest work in this area this summer here in the Twin Cities at the 4th International Alzheimer's Conference on this. So I think this is promising.
Okay, and how long would that be out? Is this still being researched? If they
well,
make
this
already
will
the
not
stuff?
be. This would probably not become available if everything was to work out, which is a big if.
Right.
This would probably not be available for human use for many, many years. I would say maybe 10 years.
Okay.
But I think that that is our best hope in terms of prevention.
Now where the rubber hits the road.
Yes.
There are all of those people taking those powders that are lecithin and some kind of other choline precursors and stuff because they say, oh, it improves my memory. I mean, we have so many testimonials. You get them from mail order companies and stuff.
Yeah.
Is there a shred of evidence that that helps?
Well, I honestly have not seen any studies that would convince me that taking lecithin, which is phosphatidylcholine, it's a naturally occurring lipid, or taking choline, that either one of these by themselves will improve the memory of an Alzheimer's patient or the functioning of an Alzheimer's patient. I don't really think that by themselves these substances are going to be very helpful. There are a lot of things out there that people are marketing for Alzheimer's. You hear a lot of talk about chelation therapy, for example. Chelation therapy, when I actually decided to look into chelation therapy and I called the people who were talking about it being good for Alzheimer's, had said that certain doctors had done this, and I called those doctors. Even those doctors they claim had done the work said that they didn't think there was any evidence that chelation therapy would help Alzheimer's patients. Further studies have been done by the Alzheimer's Association out of Chicago, and they have not found any benefit of chelation therapy. So I think there are many therapies being sort of touted which probably have no benefit, you know, and are not going to really help people.
Now, just to get back, chelation therapy, what is that? Can you define that for us who do not do this?
It's a process by which certain metals and other things are removed from the blood using chemicals that can grab onto them and take them out. I should point out that there is one medication that has been approved now for Alzheimer's patients, and that is the drug Cognex. This drug used to be called Tacrin or THA. It has had a variety of names that people may have heard. But Cognex has been found to improve the functioning of about 20%, perhaps 10 to 20% of the patients who take the medication. It tends to be most helpful in the earlier stages of the disease, I think. You know, it's not likely to be of a lot of benefit to someone who's been in a nursing home for many years with Alzheimer's. But to people in the early stages, it does offer some hope. It can, however, cause some liver damage, and so in order to be sure that that isn't occurring, it's important that the person be monitored and have their liver enzyme levels monitored by taking blood tests. But if they speak with their physicians, they can ask about Cognex, and that's a medication that may be of help. Another medication that has been found to be helpful in research studies is a drug called nimodipine. This is produced by Miles Pharmaceuticals. Cognex, I should have said, is produced by Park Davis. But nimodipine has been found in studies done in the United States and in Italy to benefit patients with dementing illness as well. The studies with nimodipine, though, are not as far along as the ones with Cognex.
Nimodipine now, that's classified as a calcium channel blocker, right?
Yes, it is. That's right.
And it's mostly active in the brain. It's also known as Nimotop, I believe.
Right.
Now, the calcium channel, is that important in Alzheimer's, the calcium flow?
Calcium channel is quite important because we know that most cells have very active calcium pumps inside the cell that keeps calcium out of the cell. Any calcium that gets in the cell is pumped out by the calcium pump. When calcium enters the brain cells in too large a quantity, it can cause the death of the brain cell. And we don't really know what the process is in Alzheimer's, but we suspect that there is a decrease in the energy level of the cells. We know that the utilization of glucose, the energy source of the brain, sugar essentially, the energy utilization goes down in Alzheimer's disease. And it's possible that, that calcium may be entering, that nimodipine may function to keep calcium out of the nerve cells and keep them alive longer. There are other potential actions of a calcium channel blocker like nimodipine too on the cholinergic system that's involved in memory that are probably important. We don't really know exactly how it's working, but it does seem to help Alzheimer's patients. Again, only a fraction though, perhaps 10 to 20%.
Okay. Now, coming back to Tacrin or Cognex for a little bit,
yes.
How does that work? What does that do in the brain?
Well, the way Cognex works is Cognex is capable of inhibiting the enzyme that would break down the chemical messenger needed for memory. So you have a chemical messenger in the brain that's sending memory signals. This chemical messenger is called acetylcholine. It is normally destroyed by an enzyme. That enzyme can be blocked, though, by Cognex so that the chemical messenger for memory stays around longer. So this is one mechanism. Again, the action of Cognex is very complex, but this is sort of a simplistic view of how it may be working.
Right. Is it effective forever then, or is it only for a certain time where it remains effective?
I think any person who takes Cognex or nimodipine for that point, who has Alzheimer's disease, is going to continue to get worse. The disease will progress, and so the visible or noticeable benefits of Cognex or nimodipine will not be noticed forever, no. But they will be noticed for some time in the earlier stages.
When we say earlier stages, an Alzheimer's patient in an early stage does classically what?
Well, they have usually been in for an evaluation because people, either they have noticed or their family and friends have noticed that there's some significant change in their behavior and their memory and functioning. But they are still able to carry on a conversation. They're living at home generally. They're not institutionalized yet. They may have trouble with their memory, but they can probably recognize family members. So we're talking about people who are in the early stages of the illness, not people who are bedridden and unable to carry on a conversation or recognize family members who I would, are in the later stages.
Now, we are also looking here in the United States, I understand, at a kind of a relative of Cognex or Tacrin called Elnectron.
Yes.
How would that be different?
Well, Elnectron, which is produced by Herbst Pharmaceuticals, is just a hydroxylated Cognex, essentially, or Tacrin. It is a slightly modified drug. At this point, it is really not clear that it will practically have effects that are really significantly different from Cognex. I think it's more of a, frankly, sort of a Me Too drug.
Right, okay.
Now, it may turn out that further studies will show that it is better for some reason or another, or that its side effects are different or something, but I guess I'm not real hopeful that it'll turn out to be very different from Cognex.
Then also in Europe and in Japan, they have this stuff called the cerebral metabolism enhancers.
Yes.
Whatever that is. Are we looking at those, or?
Well, a lot of research is being done on those in the United States and in Europe and in Asia as well. These medications are generally thought to act by stimulating metabolism in the brain. I already mentioned that glucose metabolism is decreased in Alzheimer's disease. In our society, sugar gets a bad name, but in fact, the only source of energy that the brain can use is sugar, except for in very rare circumstances. And I'm talking now about glucose or blood sugar. But we do know that glucose utilization is decreased in Alzheimer's disease, and there are other aspects of metabolism further down the line of sugars and their byproducts that are decreased. Some people believe that if we enhance that metabolism and get the energy level back up in the brain, that we may be able to keep the calcium pumps working better and keep calcium out of the brain cells and protect the cells that way, and do other things that need to be done. Obviously, you need energy to maintain the cells. And I think that these metabolism enhancers are generally aimed in that direction.
Okay. So are we researching them at all?
We are researching them, but I have yet to see one that has produced clinical effects that I think are real encouraging.
So in your mind, when we are looking at research at this point, we talked already about growth factors and stuff, where is the big push going to be on?
I personally think that the big push will be on the nerve growth factors. And I think we have Cognex and Nemotapine and these types of drugs. I really think the next step is to go to the nerve growth factors. The Cognex and Nemotapine really do not stop the degeneration and progression of the disease. The nerve growth factors have the potential to do that. And then, of course, many, many years down the road, we would like to look at genetic intervention and actually correct genetic defects. But we're nowhere close to being able to do that, in my opinion.
Yeah, that's sort of the same way as it goes with cancer. We know that a lot of it is related to genetics, but we really don't know how to do anything about it. And so in that vein, then, I know that there are tests out there, where they are testing some spinal fluids and stuff of patients. That would be to diagnose if somebody is genetically predisposed, right?
Yes, people are trying to develop a genetic test to see if you are at risk for Alzheimer's. That may be, even though there is no treatment for Alzheimer's, that may be beneficial eventually, because as we progress in the research and develop drugs that may be able to protect people who are at risk for the disease, whether that's anti-inflammatory drugs or nerve growth factors, then it would be beneficial to know who should be taking those drugs.
Right. Yes. Also to kind of plan with your life in a way, if we don't get any further than what we are now, so that you can. Dr. Fry, there is another one that I wanted to ask you about, and people sometimes bring this up. Is there a relationship between Alzheimer's disease and Parkinson's?
Yes, there is. First of all, people who have Parkinson's disease generally have tremor and rigidity, and they have a change in their gait or their walk and other kinds of changes. But some Parkinson's patients, in addition to that, also have problems with their memory or will have some dementia symptoms. In most cases, that's relatively mild, but in some cases it can be quite severe. And in fact, sometimes those patients are misdiagnosed as being Alzheimer's, as having Alzheimer's disease. There are changes in the brain cells that you see in Parkinson's. They are different from what you see in Alzheimer's disease when you examine the brain. But not every change is different, and there are some changes that are in common. So I think a lot of the brain diseases, whether it's Parkinson's disease or Alzheimer's disease, Pick's disease, some of the other types of dementias, there are some similarities as well as some differences. And we've studied Parkinson's disease as well. We've published papers about Parkinson's disease, as well as about Pick's disease and some of these other dementing illnesses, because we do believe that they are all related. We have at Ramsey one of the nation's largest dementia brain banks, over 1,500 cases where families have sent the brain to us or arranged with us to have the brain sent to us for diagnosis, so that the family can find out what disease are they at risk for, what disease is really in their family. And from studying these cases, we've learned a lot about these illnesses.
Okay. For people like me who don't know what that is, what is Pick's disease?
Well, Pick's disease is just another brain degenerative disease that causes symptoms like Alzheimer's, the memory loss, confusion, disorientation. There are some other kinds of symptoms that you occasionally see in Pick's disease. They tend to like to put, patients with Pick's like to put odd things in their mouth, objects and things. And there are other kinds of symptoms that may help us distinguish Pick's disease. But it's a fairly rare illness compared to Alzheimer's disease. We see very few cases of Pick's compared to Alzheimer's disease.
Okay. Dr. Fry, another thing is people are sometimes wondering out there if there are any foodstuffs or particular chemicals or dyes or something like that that they should be staying away from. That might be
I don't think there is no evidence for that, unfortunately. I wish we had something that would make it easy, but unfortunately we don't really know of any foodstuffs or things that you should be staying away from. Also, we really don't have, we know, for example, that there are certain vitamins that can help protect against heart disease, like vitamin E. We know that vitamin D can help prevent against various bone degenerations in older women especially. We have the various vitamins that seem to be helpful for preventing cancer, beta-carotene, all of these things. We don't really have one that we know of yet that looks helpful for preventing Alzheimer's disease. There's been a lot of talk about vitamin E in that regard, in terms of it being an antioxidant and perhaps helping with diseases of aging. but no one's really been able to demonstrate that it significantly reduces the risk for Alzheimer's yet. I would hope that there are people looking at that.
Because that's a very long-term study also.
Yes.
And that's sometimes what hampers these things too. It's not that nobody's doing anything about it, it's just that it takes forever.
It takes forever. Also, people don't realize that in general the federal government and other funding agencies are not willing to fund longitudinal studies. That is, they are not willing to fund a study that says, let's look at these people who are doing certain things and follow them for the next 20 years and see what happens to them. Because those kind of studies are expensive and basically they are not funded.
So if we as a taxpayer don't have immediate benefit, we don't do that.
That's right. Okay. Usually people do other kinds of studies, but they don't want to pay in general for longitudinal studies. There are a few that are done, but not many.
Dr. Fry, let's talk for a minute about the importance of autopsy. When we have somebody in our family who had Alzheimer's, or we thought had Alzheimer's, when we're looking at, I know you have probably looked in your career at umpteen brains, do you still always find new things that you didn't know before? Do they all look alike? Why is autopsy important?
Well, autopsy is very important. First, I think from the family's perspective, it is important. If there are a number of individuals in your family who have had similar symptoms and similar dementing illness, then it's very important to have an autopsy because there may be some increased risk in your family, genetic or hereditary risk. And without having an autopsy on one or more of those individuals, you don't know what disease you're at risk for. Right. Are you at risk for Alzheimer's disease because of some genetic alteration in this ApoE gene? Or is it just that your family is inheriting high blood pressure, diabetes, other risk factors for stroke, and maybe they're experiencing dementia due to small strokes. So this is important, particularly in families where there's a lot of dementing illness. From the researcher's side, it's very important because it is only by studying the brains of individuals who've died with Alzheimer's disease and other dementing illnesses that we have learned all the things that we have learned about the deficiency of the chemical messengers needed for memory, the cholinergic system being altered. That's what led us to Cognex. That's what led us to some of the other medications that are being developed now. So I think that having that tissue available is important for research as well.
Okay. Now, when we do have an autopsy, I know that, and I talked to Mary Bishop from the Alzheimer's Association about this before, there is a charge, and people sometimes feel that maybe that shouldn't be. Why is there a charge? And so we have trouble at times motivating them. It's also very emotional.
It is.
Now, besides getting the answer, yes or no, it was Alzheimer's disease, can we determine the cause from an autopsy? Because last time when we visited, we were talking about there may be more causes than just genetic causes for Alzheimer's.
We cannot determine the cause. What we can determine, though, is if it is not Alzheimer's disease, we can determine what illness was it. We can see the infarcts if it's dementia due to stroke. We can see the Parkinson's changes if it's Parkinson's. We can see the Pick's disease changes if it's Pick's disease, or what have you. So the benefit to the family is finding out what illness was it. And sometimes, of course, it's more than one illness. We have patients who have Parkinson's and Alzheimer's. We have patients who have dementia due to stroke and Alzheimer's. So, but I think that the benefit is learning the diagnosis, the accurate diagnosis. There is nothing in an autopsy, though, that will tell you at the present time whether the disease was due to some genetic abnormality or whether it was due to some environmental exposure or both or what have you.
Oh, I kind of thought at least they could find the genetic defect.
No. Not at the present time.
Okay.
Now, it's unfortunate that families have to pay for these autopsies. In an ideal world, they should not have to pay for these. But the federal government and the other funding agencies have not seen fit to pay for autopsies. So in general, if people decide they want to do an autopsy and find out what the illness is that their parent or grandparent had and what they may be at risk for, they are going to have to pay for it. And in the Twin Cities, it costs about $500, somewhere in that ballpark.
But I kind of think it would be money well spent, in a way.
I think it is, and most people feel that it is. When you think of what they've spent already on nursing home care and everything else, a lot of times they're willing to spend an extra $500 to find out what it was that caused all the trouble, and what, if anything, do they have to be concerned about.
Now, talking about treatments for Alzheimer's disease, there was something that, this is just for historical purposes probably, whatever happened to the bethanechol pump? There was something that...
Well, the bethanechol was First of all, the idea of pumping drugs into the brain is still around. In fact, Medtronic here in the Twin Cities has a pump which I have heard, I believe this is accurate, that there may be a company in California that may be planning to use the Medtronic pump to deliver a drug for Alzheimer's disease, perhaps even nerve growth factor. So the idea of using pumps to deliver treatment to the brain for Alzheimer's is still around. Bethanechol was a particular drug, though, which acted like the chemical messenger for memory acetylcholine. It was sort of a replacement for acetylcholine. I was not enthusiastic about that drug at the time it was tried, and I think that uniformly, though, that drug has not proven to be very beneficial, and drugs like it that have been pumped in to the brain have not so far proven to be beneficial. So I think it was simply dropped as something that didn't look very promising.
Yeah, many of the precursor, substances that we have been giving to patients, they are also inactivated in the stomach, aren't they?
Yes.
And cause a lot of side effects.
Right. If you're particularly, for example, choline, if you take choline, the people who take them tend to end up smelling like dead fish. I mean, it gives you a very bad odor. Doesn't seem to help very much either. But I think that the pump will be superseded by less invasive methods, like the intranasal delivery method that we're developing, or by some other method. Because to use a pump, you have to implant the pump somewhere, you have to run a tube up into the ventricle of the brain. It's a very invasive procedure.
So then you also have sources of infection again.
Oh yeah,
and
you
all
have a
that kind
lot
of
of
stuff.
potential problems that I think people are going to want to avoid.
Now, for people who do not qualify for Tacrin and all of those things, there we mostly, and we're going to have again just a little bit of time left, we mostly do some supportive care, right? Like treating the agitation and all that kind of stuff.
There are medications to help deal with the sleeplessness, to deal with the incontinence, to deal with the agitation that the patient may have, or the paranoia that the patient may have, combativeness. Sometimes patients become very aggressive. And even with the depression the patient may have. So there are treatments for the symptoms that families should avail themselves of through their physician.
Okay. Well, Dr. Fry, we are again out of time. And I thank you one more time for coming and for talking to us about Alzheimer's. And again, I thank the people out there who have been watching. Please tune in again next time. And until I see you, stay safe, stay healthy, and good night.